Hello friends, in this video we are going to discuss about the first heart sound MCQ discussion. We will also see the question. We will start with one question. So let's read the question, MCQ question. A 50-year-old female came into the OPD with the complaint of a palpitation, heat intolerance. Her ECG was performed on OPD basis, and what is shown, PR interval was shortened and there was a tachycardia present. Now, when we do a clinical examination, and what will be the characteristic of the first heart sound? So, in the large questions, actually we first read the last line. So, here also, what is the characteristic of the first heart sounds? What are the characteristics possible for the first heart sound? So, we all know heart sounds can be soft, it can be loud, splitting, or the reverse splitting. There are four possibilities. So, now from them, which is the right answer for this question? So let's discuss something about the first heart sound and the PR interval. So PR interval is actually it is an interval between the atrial and the ventricular depolarization actually. So it is a gap of an electrical activity, but we all know electrical activity is ultimately followed by the mechanical activity. So we can say that it is an interval between the atrial and ventricular contraction starting initiation. Okay, fine. Now, what is the normal duration? So, normal duration, it can be between the 0.12 to 0.2 second. In our case, the PR interval is shortened. What that means? That means the PR interval is actually less than 0.12 second. You all know why the first heart sound produced. So, first heart sound produced because of the closure of the AV valves. So, bicuspid and the tricuspid both are closed, and it will produce a vibration into the fluid inside that, and that will produce a sound. That is the first heart sound. Okay, fine. Now what occurs when there is a shortened PR interval? Okay, fine. Or when there is a tachycardia. So in that condition, that means the ventricle starts contracting even when the atria are still in contraction phase. So these start contracting. So when they start contracting, the mitral leaflets are away from each other. They are very far from each other. So as soon as the ventricles start contracting, even though when the atria are in contraction phase, then it will forcefully close the mitral valve. So mitral valve is fully open and the ventricle systole starts. There is a forced closure of the mitral valve. And if the forced closure of the mitral valve occurs, what will it produce? It will produce the loud sound. So the answer is here in our condition. Obviously, it will produce the loud S1. Okay, fine. So let's see what are the other conditions in which there is a louder S1 sound. So now you all understand when there is a tachycardia, when the atria are in systole phase, ventricles start contracting, mitral valves are away from each other very far, and they will close very forcefully and produce the loud S1 sound. So we got the answer. Our MCQ is answered. But let's understand some more about the S1 sound. So what are the other conditions in which the S1 sound is loud? So if you have focused, it was the female also having a heat intolerance. So in summer, everybody having a heat tolerance. But case is going towards the thyrotoxicosis. Okay, fine. In which there is a tachycardia is there, PR interval is shortened. Okay, fine. So tachycardia also will produce the loud S1. Thyrotoxicosis will produce even beriberi vitamin B1 deficiency, and mitral stenosis and tricuspid stenosis, they will also produce the louder S1. Why there will be louder S1 in case of the mitral stenosis or the tricuspid stenosis? Because it will prolong the AV filling. When the AV filling is prolonged and they are closed, they can produce the loud S1. Now, what are the conditions in which there is a soft S1 sound? So we can easily say that one conditions because of the poor conduction. So we are listening to the first heart sound and the conduction is poor. So what are the conditions in which the conduction is poor? So if there are effusions, pericardial effusion, or emphysema and obesity, okay, fine, and mitral regurgitation and the tricuspid regurgitation. Because in the regurgitation, the blood is flowing into the reverse direction, right? So into the regurgitation, these valves, the blood is flowing into the reverse direction. They are not properly closing. So when they are not closing properly, it will produce a soft sound, right? So in case of a regurgitation, there will be the soft S1. So in case of the mitral regurgitation or the tricuspid regurgitation, it will be softer sound. Even in mitral stenosis, if the valves are very much calcified, if the walls are calcified in the stenosis, but if they are very much calcified, they will also produce the soft S1. So remember that when there is a lot of calcification into the heavy wall, in case of the stenosis is there, then it can produce the softer S1. Okay, so we've just seen that in case of mitral stenosis, there is a loud S1, but in case of if the walls are very much calcified, then in case of that, there will be the softer S1. Now, is there any splitting of the S1? Let's understand about the splitting of the S1 sound. So we all know into the heart, this tricuspid valve and the bicuspid valve, they both closed together. So they will produce a single sound. Okay. But so normally we do not listen any splitting into the S1 because the gap of splitting is 20 to 30 millisecond only. But and which valve is closed? Obviously, always remember left side close earlier than the right side. So it will be in case of if we see splitting, then it will be the M1T1. Left side closed earlier always than the right side. So it can be M1T1, means mitral will close earlier, then there will be the closure of the tricuspid. But what occurs? We all know that from the AV bundle there are two bundles are going onto the right side as well as the left side. But if the conduction is delayed because of the right bundle branch block, if there is a block into the right side bundle branch block is there, this right ventricle get the late impulse for the systole, and in that case is this tricuspid valve will be little delayed closure. So there will be the gap between the M and the T component of the S1 sound. So it will be more than the 30 millisecond, then we can listen the splitting also. But what can be the reverse splitting? In the reverse splitting, what will occur? There will be reverse in M1 T1. There will be the T1 and M1. Right? So first right side tricuspid valve will be closed, and then the left side mitral valve will be closed. So in that case is what are the reasons for the reverse splitting? So just remember, if in case of the left side bundle branch block is there, if onto the left side there is a bundle branch block, then we can listen the reverse splitting also, because there will be the delayed the closure of the mitral valve, and in case of the severe mitral stenosis, very small gap between the mitral leaflets, then in that case is also there will be the reverse splitting. So there are 4 conditions possible into the S1 heart sound. It can be louder, it can be softer, it can be split, or it can be reverse split. So just remember the few causes for this. In case of for the louder S1, tachycardia, then thyrotoxicosis, these are the reason. For the softer S1, there is a conduction problem in case of pericardial effusion, empyema, obesity. Okay, and for the splitting, for the wide splitting, M1T1 right side bundle branch block. If there is a left side bundle branch block, there is a reverse splitting. In case of a severe mitral stenosis, reverse splitting is also possible. So these are the things, and you all have got the answer. What was the answer in this condition? There is a larger loud S1, right? So that's all about today's MCQ. Thank you for listening.